My name is Dr. Clement Nzuka. I'll be talking to you today about a topic I got motivated to talk about this because of my patient who came to me saying, Doctor, I can't lie on my back. Any explanation? When I lie on my back, I get some kind of a respiratory distress. I become breathless. What could be the problem? And this motivation, I'm getting it from two patients actually. One is a young guy who's 22 years of age. This patient was HIV infected. He had, swollen extremities. And I didn't know what was going on. I said, could this be nephrotic syndrome? Could this be a heart failure? What's all this? All I knew was that the patient is HIV infected. Now, I've just recently seen a lady who's 8 years of age. She says to me, I can't lie on my back. I need pillows. I need to be supported by pillows. Quite a number of them. You can make them 3, even 4. I would appreciate that. Because when I lie on my back, I become, breathless. I have some kind of a respiratory distress. What could be the problem? Then I said, I'm going to do heart failure today. Whether the heart failure is caused by a heart attack, what, I'll have to find out from history. I spoke to my patient. I said, look. Have you ever had, this is the 8-year-old, have you ever had a heart attack before? Or were you ever admitted for a heart attack? She said to me, yes, doctor. The explanation I got from my doctor was that I had a heart attack, and that's why I got admitted. Oh, then I said, oh, heart attacks. Heart attacks, they damage the heart tissue. They damage the heart tissue, what is known as the myocardium. And you must remember the myocardium is the one that's responsible for the pumping. So now, if it gets damaged, how's going to be the pumping? Then I said, I'm going to do heart failure. One of the complications of a heart attack is heart failure. So today I want us to talk about the heart failure. Heart failure, for us to understand the heart failure, we need to be able to say, we have a left side of the heart, we have a right side of the heart. The left side of the heart has got a filling chamber. And a filling chamber progresses divided by a valve that will allow blood from the filling chamber to go into the pumping chamber. The pumping chamber, the filling chamber is given a special name. They call it the atrium, and the pumping chamber is called the ventricle. So you have this pair on the left, and you have the same pair on the right. Right atrium, left, right ventricle. Left atrium, left ventricle. So when the heart is failing to pump, so it means it is the left side. If it's the left side, you are gonna get it. If it is the left side, or it is the right side, you are going to get it from the symptoms. The patient is going to tell you, he's going to say, the patient is going to say, I'm breathless, I'm out of breath when I lie on my back. So that tells me that let's look at the left side. It directs me. Let's look at the left side. So it means the ventricle, the left ventricle, or the left pumping chamber is failing to do what it's supposed to do. What is it supposed to do? It's supposed to pump blood through the aorta to all the parts of the body. And that includes the heart itself. There's a branch of the aorta. They call it the coronary branch. And the coronary artery comes back to the myocardium, comes back to the heart itself and feeds the heart and gives it what it's supposed to get. You know the heart, it feeds the whole body with nutrition. It feeds the whole body with oxygen. It supplies oxygen, it supplies nutrients to the whole body. And it will supply even to the heart itself. So when the heart is failing to do that, it's failing, so there's going to be insufficiency. Remember, it's supposed to deliver oxygen, it's supposed to deliver nutrients to all the parts of the body. So there's going to be insufficiency there. But now, the most important thing that I want us to look at today is how does the heart, what happens when the heart is failing to pump blood through the aorta and pump it to all the parts of the body? It's failing to do that. So the blood gets stored in the very heart. It doesn't go out. But the filling chamber continues to fill. So what's going to happen? A buildup of pressure. And this buildup of pressure becomes a problem. Because now, the blood, when the heart is pumping, it's supposed to pump in a unidirectional way. In other words, one direction, forward only, never backwards. And now, we're seeing a situation now, because of the buildup of pressure, because of the failure of the heart to pump blood to all the parts of the body, we are getting a problem now. Buildup of pressure because of the accumulation of the flow of the blood. It accumulates in the left ventricle and the left atrium. You know, the filling chamber, it's like it's not filling the ventricle. It's like it's not doing, it keeps on getting, it gets, it's important to know that it gets blood from the pulmonary vein, and the pulmonary vein is from the lung, and that's important to understand. So the vein is carrying good blood. This vein, this pulmonary vein, is carrying oxygenated blood. Remember, the blood was sent to the lung for oxygenation. Now it's carrying oxygenated blood to be sent to all the parts of the body. And this is not happening. The heart is failing to do that. So now there's a buildup of pressure and pushes the blood back to the lung. This pressure pushes it back to the lung. This is now a problem. If it goes back to the lung, The lung is an organ that is filled with Essex. Essex. Some people call it the alveoli. The Essex, they are there for gaseous exchange. When you say gaseous exchange, what do you mean? I mean oxygen in during inspiration. And I mean during expiration, I mean carbon dioxide out of the body. So this is done so perfectly by the Essex. Essex are normally very dry. They are dry. But now, because of the buildup of pressure, the blood is now going back to the lungs where it originated, where it was oxygenated. Now it's going back to the lung. What happens is something very drastic. The water from the blood migrates into the Essex. Because the Essex, that's the only thing that, the blood is coming back. I don't have a place to accommodate you. The only thing that can happen is the pressure. Because it's under pressure, the water from the blood is transmitted onto the Essex. And the Essex starts, the Essex, they start having what is known as frothy fluid. When the patient is coughing, the patient coughs a frothy fluid because it's where it's not supposed to be. For a thorough understanding of this, we have to think of a sponge. The lungs are like a sponge. And the lung parenchyma is what you'll be looking at when you're looking at a sponge. That's a lung parenchyma. But then a sponge is having these holes all around it. And those will be your Essex. But now, if you have a dry sponge, when you squeeze it, it's very easy to squeeze it. When you take the same sponge and soak it in water, and you try to squeeze the sponge, now you have to increase the effort of squeezing because you've got water to get out of the sponge. So that's how you should look at a lung. It's like if it is soaked, it's like the Essex are full of water from the blood. And it is an effort for the patient to try and squeeze out this fluid so that you can have an Essex or an alveolus that is without any fluid so that there can be gaseous exchange. So it's an effort to breathe. It's an effort to breathe. So this is the worst thing that happens with heart failure. It's an effort to breathe. The patient has what is known, the patient breathes with difficulty. The patient becomes breathless because of this effort that, they give it a special name. They call it a dyspnea. Because the patient, the lung is actually congested with blood. It's congested. It's congested with the fluid. It's congested. So this is what is known as pulmonary congestion. This is because of a heart failure. The heart was doing what it's supposed to do. It was supposed to squeeze, to make sure that to pump blood out through the aorta and pump it out to all the parts of but that's not happening. So there's a buildup of pressure such that the blood has to now, the unidirectional nature of motion of blood, that we were boasting about, saying that, no, this is what is happening. There's always unidirectional. It's unidirectional. It's not happening because the heart is failing. It is not happening. It is now going back, and it goes back to the lung. The lung is not used to any fluid. The lung is used to one thing. It's used to exchange. Its function is to exchange gases, gaseous exchange. Carbon dioxide going out, oxygen coming in. That's the function of the lung. The lung is supposed to do that. But that's not happening. If it happens with a great effort. You have to squeeze the lung first to get rid of the water that is in the essex or alveoli. And this is a big problem. And for the patient, it's a mammoth task. It's a mammoth task. The patient develops what is known as dyspnea because of pulmonary congestion. Pulmonary congestion comes about because of heart failure. This is left side of the heart. This is the left side of the heart. I would like to make sure that people understand that the left side of the heart, when the left side of the heart is failing, man, if the left side of, the left pumping chamber is failing like that, well, what happens to the filling chamber? The filling chamber is full of what? Full of blood. So what's going to happen to this blood? It's going to be stagnant there, because it's trying to move backwards, but on a slow fashion. It's going to be stagnant there. So if it is stagnant there, so what happens? It's like a thrombus. It's like a thrombus. It solidifies. It forms what is known as a thrombus. Once you have a thrombus, you worried about a day when the thrombus breaks to form an embolus, to form that piece. If the heart goes back to normal beating, because now, maybe I should explain this. When the filling chamber, when the filling chamber forms this thrombus, it's because the filling chamber has stopped pumping. Because it has stopped pumping. It's what is known, it's trembling now. Trembling is not contraction. It is not beating. So the atrium or the filling chamber has stopped beating. And that is why it forms a thrombus. And that is why now there's a risk of embolization. In other words, the breaking of a dislodgement of a part of the thrombus going straight to the pumping chamber, may be pumped out. And when it is pumped out, it does something else. One should pray that it should not go to the cerebral arteries. Because if it goes to the cerebral as a thrombus, as an embolus, or that portion, that solid, it blocks there in those cerebral arterioles. And it blocks there. And when it blocks there, what will happen? Are you hoping for the blood to pass that block? It will not be able to pass. And if it's unable to pass the block, what's going to happen? The distant portion of the brain, this time maybe the cerebrum, distant part of the brain, will it function if it doesn't have blood? It will not function. If it doesn't function, if it doesn't have blood, what's going to happen? There's going to be a formation of what is known as an infarct. An infarct is a dead tissue there. So a cerebral infarct, a dead tissue. Think of an area of the cerebrum that controls speech. You think the patient will be able to talk or to speak easily? Speech will be affected. For instance, we've got areas like the Broca's area, Winnicke's area, they control speech. That is in the cerebrum. If the blockage, it depends what the blockage is. If the blockage is this is because of a failing heart. If the blockage is on the cortex, normally the cortex controls, motor functioning. So the motion, the movement is going to be affected. So the patient will have what is known as a paresis or hemiparesis. This is now a stroke. So a stroke caused by what? By a heart failure. Because of the thrombus that was formed in the filling chamber. And it was stretched, the wall of the was stretched, got swollen and stretched and all that, and it forming. Instead of what? Instead of beating, it stopped beating. It started trembling. This trembling is given a special name. It's called atrial fibrillation because it's fibrillating. It is not beating. It is not beating. So fibrillation, atrial fibrillation, gives rise or precipitates to a stroke, and that is why there was an embolization, a dislodgement of the thrombus, and a part of the thrombus was dislodged, and it went into the left ventricle, the pumping tube, and it got unfortunately pumped out, and it went straight to the brain, cerebral arteries, and there, when it gets to cerebral arteries, it will get even to the arterioles, and then it gets blocked. It gets the blockage, and then that will precipitate a stroke. This is crucially important to understand that atrial fibrillation, which comes about because of the failure of the heart. The heart has failed to pump. It goes to an extent of, it just, the atrium or the filling chamber just trembles. Instead of beating, it trembles. And then when it trembles like that, we say it is fibrillating. So that's what is known now as atrial fibrillation. Because of a failing ventricle. The ventricle has failed to pump. Because it has failed to pump, so now we have a problem. We have a problem of precipitation of a stroke because of atrial fibrillation. So atrial fibrillation would not have been there at all if the heart was pumping. If the pumping chamber was doing what it is supposed to do, that is to pump blood to all the parts of the body. But if blood becomes stagnant there, or it is pushed back, there's this pushing back of blood, going back, causing problems. When it goes to the lungs, there's now pulmonary congestion. That pulmonary congestion gives rise to what? To a dyspnea. A patient who has a dyspnea, who's the work of breathing is increased, and that is why the patient has got dyspnea. This is important to understand. Why is the patient out of breath? It's because it is because the alveoli or the essex, they are filled with water. And you don't want that. What is the function of the essex? Gaseous exchange. Can it succeed with gaseous exchange if there's water? No. That is why the lung has got to squeeze it out with difficulty. Squeeze it out. And this is what we need to understand by left ventricular failure. Left ventricular. When there's left ventricular failure, this is what you see. You see a distressed patient, dizzy, patient out of breath, patient breathless, patient, you see it. Patient can even get into a stroke situation because of atrial fibrillation. The atrium or the filling chamber stopped pumping. And when it stopped pumping, it forms what? A thrombus. And the thrombus has got the probability is very high that it will break off. If a piece breaks off, that's dislodgement, can cause problems, because if it is pumped, it goes to the left ventricle and it is pumped out, it can go straight to the brain, to the cerebral arteries, where it will form an blockage, as an embolus, as a clot there, and it stops blood, it obstructs blood, so that blood is unable now to get to the areas where it's supposed to go. And I don't want to think of a situation when it goes to the Broca's area. I don't want to think of, which controls speech. I don't want to go to think of a situation when it blocks the blood going to the Winnicke's area. That's for speech. Those areas, the patient starts to have what is known as, the speech becomes, there's a defect in speech. And when there's a defect in speech, they call it aphasia. Aphasia. These patients, they normally have what is known as aphasia. The speech is affected. They can't speak well because of, and some people, some doctors, they're able to diagnose a stroke just by looking at the patient who's unable to have a proper speech, right? Unable to talk. So now, what you should do, walk home with, is that heart failure could have been caused by a heart attack, but heart failure is going to give rise to a dizzy. Heart failure can cause atrial fibrillation. Atrial fibrillation, which can precipitate a what? Precipitate a stroke. This is a problem. Heart failure. Thank you very much. Thank you very much for listening to me, and I hope you will walk home knowing that heart failure, the left heart failure, that today we discuss the left side of the heart when it is failing. And when it fails, you're thinking of dizzy. You're thinking of this patient who has dizzy. You think of this patient who might present with hemiparesis, a stroke. Thank you very much. Bye-bye.